Hi there, welcome to the video answers for this set of Part 1 questions. Let's get started. First question. Clopidogrel or Plavix and ticlopidine are commonly used after an MI or cardiac cath with stent placement. What is the mechanism of these drugs? So both clopidogrel and ticlopidine prevent platelet activation by irreversibly blocking ADP receptors on the platelets. The whole process of platelet activation and aggregation is pretty complicated, but we'll cover it in detail in Part 2 of this course. Next question. What are some of the signs and symptoms of pericarditis? So most patients will present with chest pain, and this is typically a sharp pleuritic pain that's worse with inspiration and made better by sitting up and leaning forward. With pericarditis, there's decreased capacity of the right ventricle, so fluid backs up and you can have JVD or jugular venous distension. With constrictive pericarditis, you can see Kussmaul's sign, which is JVD that occurs with inspiration. Normally, inspiration decreases intrathoracic pressure, so that blood from the superior vena cava flows into the right atrium and then the right ventricle. But if you have constriction of the heart, that blood will not fill the heart and you see JVD during inspiration. You can also hear a loud pericardial friction rub. That's a scratchy, leathery sound that doesn't really coincide with anything else in the cardiac cycle. Then you should also know the EKG findings of pericarditis. You might see diffuse ST elevation and possibly diffuse PR depression. Next question. What common over-the-counter medication is used to remove excess thick sputum by stimulating the vagus nerve to generate low viscosity secretions in the bronchial tree? So this is guaifenesin, which is found in many over-the-counter cough remedies. It's a mucolytic, and it basically makes mucus thinner so that it's easier to cough up. Next question. Preventive vaccines have been developed for which encapsulated bacteria? What test can be used to detect encapsulated bacteria? So, we have a vaccine for Neisseria meningitidis. There's a vaccine for strep pneumo, which is called a pneumococcal vaccine. And then there's a vaccine for Haemophilus influenza type B. And then what's the test to detect encapsulated bacteria? So you add a serum that contains anti-capsular antibodies, and then you look under the microscope, and what you're looking for is the Quellen reaction, which is where the capsule appears to swell in response to the antibodies. Next question. A 30-year-old Asian woman presents to the clinic with a variety of complaints. Upon completion of your exam, you suspect Takayasu arteritis. What symptoms does this patient likely have? So Takayasu arteritis is a type of vasculitis that affects the aorta and the branches that come off the aortic arch. So it affects the arms and the carotids. So these patients can have lightheadedness, headaches, and vision problems. They might also complain of claudication in the arms. And then on your exam, you would find diminished pulses in the arms. So we'd sometimes call Takayasu arteritis the pulseless disease. Patients will have an elevated ESR, and the treatment here is corticosteroids. Next question. What are the carpal bones of the wrist? The mnemonic for that is, some lovers try positions that they can't handle. So, starting on the radial side, the proximal row is scaphoid, lunate, triquetrum, and pisiform. So that's your some lovers try positions. And then, going back to the radial side, the distal row is trapezium, trapezoid, capitate, and hamate, that they can't handle. So for that mnemonic to work, you have to start both rows on the radial side, and you start with the proximal row of bones. Next question. A 6-year-old boy is receiving poor grades in school. His teachers and parents report that he has normal intelligence, but that he's very distractible and full of excess energy. What medications might help this boy? First, let's make the diagnosis. So this is a classic case of ADHD, or attention deficit hyperactivity disorder. One important thing to remember here is that the onset of ADHD has to be before the age of 12. This is new with the DSM-5. Before, it was age 7. Now, symptoms must be present before age 12. So the treatment for ADHD includes stimulants, like amphetamines or methylphenidate, atomoxetine, which is not in the stimulant category, and behavioral interventions as well. Next questions. Why is diphenhydramine or Benadryl a poor medication choice in the elderly and in those with BPH? So a couple of reasons. First, besides being an antihistamine, Diphenhydramine also has prominent anticholinergic side effects, and it can push elderly patients into delirium and confusion. And it can also cause urinary retention, which is also an anticholinergic side effect, and that's a bad idea for patients with BPH, who may already have a little baseline urinary retention. The other issue is that diphenhydramine is not a good idea for treating chronic insomnia. It can be sedating and help people fall asleep, but it disrupts normal sleep architecture. So it doesn't really produce good quality and restful sleep. Next question. On which cells would you find CD4 molecules? On which cells would you find CD8 molecules? And what actions do these CD8 positive cells accomplish? So, CD4 molecules, that would be the T helper cells. CD8 molecules, so these are found on cytotoxic T cells. And what actions do these CD8 positive cells accomplish? Well, cytotoxic T cells basically go around and bind to their target cells and kill them by inducing apoptosis. They kill virus-infected cells, they kill neoplastic cells, and they can also kill cells from a transplant donor. And last question. What breast pathology fits each of the following descriptions? So what is the most common breast tumor in women under 25? That's fibroadenoma. Most common breast mass in postmenopausal women? That's invasive ductal carcinoma. Most common breast mass in premenopausal women is fibrocystic changes of the breast. And the most common form of breast cancer, that's invasive ductal carcinoma again. So that's it for this set, guys. See you next time.